We're looking for a change in culture here. This isn't like other countries in terms of health behaviors. And it is not what the community expects to do at this time. People don't expect to bring their child to the dentist at age 1. The dental community isn't even there yet. So how could we expect the community at large to be there? So this is a change that is going to occur over time, and that's why it's so important to stay on message and find ways to educate our community about the importance of an age 1 dental visit. Because it's one thing to get our providers all excited about a program, but if no one shows up in their offices, our providers will forget real quickly that it's important to do. So part of our role as a dental community is not just to see the kids in our office, but to get other folks in the dental community, dentists, hygienists, public health types, to consider doing a Points of Light program in their community. So what can we do? How do we motivate others to see kids? Well, firstly, appeal to morality. It's the right thing to do. Preventing disease, preventing the types of caries and problems that Dr. Carrico reviewed with us this afternoon. We all see them every day in our practice, and we've seen them throughout our career, and largely they haven't changed. And we know that the CDC said that they're in fact getting worse. So it makes sense to focus on prevention in this population and to start early. Secondly, if you don't get it for morality, do it because it's the standard of care. American Dental Association Dental Home Policy says that we should see kids starting at age 1. That means that if a dentist receptionist is answering the phone and saying, oh, we don't see kids until they're in preschool, that's the wrong answer, right? That's not the standard of care. That dentist should let the patient calling on the phone, we don't see them, but we can refer you to someone else that can. At a minimum, I would like to hear that. Ideally, they should be meeting the standard of care, and that is they should be seeing kids at age 1. If we don't see infants, the dental community, the medical community, if we don't see infants, someone else will. Someone less qualified will. Alternative models of care are being promoted in other states. We don't want that to occur. We want kids to be seen by people that know what they're doing, recognize dental disease, and make appropriate recommendations. Offering preventive measures enhances our status in the professional image in dentistry. We're just not whole drillers, we're just not doers to people. We also can get paid for talking to people, giving good advice. That's what professionals do, right? And I know after hearing Dr. Hale speak many times, he's probably hammered that point well this morning. And then I think another point that was talked about, it's a potential increase in new patients. In my private practice, there's been an age 1 dental visit program long before I joined there, so I'm in a practice that it was very easy for me to join in. The program was called the Terrific Toddler Program. And as I came there 4 years ago, we're focusing much more on the younger children, not just true toddlers in the sense of the word. The age 1 visit is a very fun and easy visit in our office. 75% of the visit is conducted by the hygienist. It's not done by the dentist. So those dentists who say that they don't have time in their busy schedules to conduct infant oral health programs, not true. It's literally minutes, 3, 4, 5 minutes, depending on how much that dentist enjoys playing with babies and interacting with the young moms. You can take the full half hour if you need it. But I can tell you, in my practice in a busy pediatric office, it's more along the line of minutes. And to just give you a sense of how it mechanically works in our practice, the hygienist reviews the same types of things that Dr. Carrico and our fellow hygienist said. But after they assess everything that's going on in the child's mouth, the child's habits, I get a brief huddle with them. They tell me what's going on, and then I get an opportunity to go in and do my exam, discuss growth and development, look at what's going on, and reinforce those preventive recommendations that need to be made, and then lastly, applied fluoride varnish. So really the hygienist is the key to this in most busy offices, and you saw our hygienist did a wonderful job today, and I can see how passionate they are about what they do.